Good afternoon, everyone. A warm welcome to everyone to this very special health event exclusively conducted for Khaleej Times employees by Aster DM Healthcare Group. We have two prominent persons, all of you know, Mr. Sagir Ahmed and Mr. Sagir Ahmed Khan, our Senior Vice President, Khaleej Times, and Padma Shri Dr. Azad Moopen, Chairman of DM Healthcare Group, join us here. And we have an elite panel of doctors also. Before going to this session, let me formally welcome all of you to this function with a brief introduction. You all got to know about the session yesterday. I know it was a short period, but thank you all of you for coming over. Only some of us know that it was Mr. Sagir's idea to arrange flu vaccination for KT staff through DM Healthcare Group, who are our partners in bringing out our weekly health page. But when the proposal was put forward through our senior colleague, Mr. Isaac John, they were willing to offer more than the free flu shots. I understand that it is also to mark their 26th anniversary, which they celebrated yesterday, and they have arranged this vaccination program and an interactive session on preventive health for the benefit of the Khaleej Times employees. I must say this is a perfect gift for KT on the occasion of our 35th anniversary. It was only by late evening yesterday that I was officially asked to moderate this session. But quite coincidentally, Dr. Azad and I shared the stage at another function last night. There at a condolence meeting in memory of a veteran Indian journalist in the UAE who passed away last week, Dr. Moopen delivered a brief speech reminding all of us present there about the 5 roles that we need to play in our lives. And the first and foremost of them was a role, or rather responsibility, to our own health. Keeping our body and mind in good health is the most important responsibility that we all have, he said. It was a very enlightening speech and a kind of jyoti revelation to me. Standing here to moderate this session on prevention is better than cure, I feel I cannot give a better introduction to this session than this. I am a classic example of how many of us in the field of media don't walk the talk when it comes to the matters of health. I feel this is the right time for me and all of us to take better care of our health and let this session be a good start for that. I would formally extend our warm welcome to Mr. Sagir Ahmed Khan, our Senior Vice President, Khaleej Times. I call upon Ms. Sarita Menon, Marketing Manager KT, to present about KT. Sorry, it was meant to be given to Dr. Azad Moopen. I extend a hearty welcome to both of you to the session. I call upon Mr. Sagir to say a few words.
I didn't know that I'm a prominent person here. I tried to put things together in this organization, and while I was driving down in one of them FM station, I heard about Dr. Moopen's drive for the flu vaccine. So I thought that I then immediately phoned Isaac. So I had an ulterior motive. By having vaccines, at least absenteeism will be lower. People will not feel sick. That was my ulterior motive. And now I thank Dr. Moopen for taking time out to be with us, and the eminent doctors and specialists here, and the audience also. I thank you to take time out of your jobs to come in. And as the saying goes, health is wealth. So I leave it to Dr. Moopen. Thank you.
Dr. Azad Moopen, if you could share your...
Thank you, Sajila, for that nice introduction. And Mr. Sagir Ahmed Khan, Isaac, Nafisa, and other people, and our doctors, the KT staff. I know many of them by face, by name. Thank you very much for cooperating with us. We are very happy to do this because of many reasons. One is our duty, and second, it also sends the message very strongly to the people who have to hear it. It's very important that awareness about such matters, that's a responsibility of the medical profession as well as the media to spread it, and there is no better way in which we could do it than by having such a session. So you have an eminent panel of doctors who would answer your questions. We can have the seminar. As has been mentioned by Sajila, I just want to, because it's very ripe in mind, I just want to tell you that yesterday I spoke about it, but little differently I would like to present it. The journalist community as such, I think, is one of the, if you look at the susceptibility of getting sick, I think they should be at the highest pedestal because of the type of job. What I have found is that especially people in the field as well as even people sitting in the office, the working hours, the tension, the deadlines, the closure time, and running behind people, running behind events, that produces tremendous strain on the people. So it's part of job. Like doctors, we also suffer this. We also have these issues. But what I have found is that yesterday in the meeting in which we were just remembering Vivekananda, the late editor of Gulf Today, we thought that it's very, very important that first you take care of yourself. Unless you take care of yourself, you won't be able to take care of others. So if you look at what is being announced in the aircraft and all, they say that when there is a requirement for oxygen, first you have to take care of yourself before you take care of your child. Like that, if you don't take care of yourself, you won't be able to take care of others. So it's a primary requirement. It's not nothing selfish. Something which is required if you have to take care of others. So it's very, very important that we all are aware of, not about immunization and all that we all know, but our own health, and that can be actually maintained, and that's a very, very important thing. Recently I was reading somewhere about somebody who conducted a survey in one of the nursing homes. Nursing homes in India and all, it has got a different meaning. Nursing homes in countries like Western countries, that means the place where the old people, towards the end of their life, they live in the nursing homes. So somebody conducted a survey and asked the inmates who were just at the brink of dying or late age, what are your most important regrets in life? So the most important regrets, 3 if you take. The first one was, many of them said that they didn't take care of themselves. They were actually not caring about themselves. They were taking care of others. In that race, they forgot to take care of themselves. And then, of course, the other 2 were something, may not be directly connected with health. They said that they always loved people at home and people around, but never found the time to tell them that they love them. They couldn't express. And they said that the most important thing is that you have to keep on telling. It's not that you have it in your mind. It's important that you also express it. So that's also a very important thing. You have to be expressive in your love. It is keeping inside. I think it is something which you are losing, giving an opportunity. Then they also mentioned, which again is important as journalists or doctors, that many of them thought that they worked very hard. They didn't take rest. That's also part of health. They always postponed gratification or taking a vacation or doing an exercise or doing things like that, because they always were working hard for a better tomorrow, but which never came. So I just want to tell you that it's important and very, very important that we take care of ourselves by way of our the spiritual health, which is very, very important, the mental health, which is our intellectual health, the physical health, which is what we are talking about now, and the social health. So if you have all these four in proper proportion, if all the four legs of the table are there, the spiritual, the physical, the mental and the social, then you will become a perfect person. So I request all of you to take care of your health, which is very important not only for you, but for the whole community. Thank you very much. Thanks a lot for this opportunity for our group to come here. Thank you.
Before we go on to the interactive session, I would like to request Mr. Sakir to present a memento to Dr. Azad.
Thank you.
I'd also like to request Dr. Azad to present a memento to Mr. Sakir. This session is titled Prevention is Better Than Cure. We'll be having a question and answer session with this elite panel of doctors here. So before we get into the session, I would like to request the doctors to introduce themselves with their name, specialty and where they work.
My name is Dr. John Cherian Vargas. I am a nephrologist. A nephrologist is a doctor who takes care of kidney problems, the medical part of it, and dialysis and transplantation. So I'll be discussing more on that aspect.
I'm Dr. K.R. Shivde. I'm obstetrician and gynecologist, and my consulting is in Business Bay, and I deal with all the patients who are having any kind of gynae problem or routine obstetrics and problems related to infertility and menstrual disorders. Thank you very much.
Hello, good afternoon. I'm Dr. Shekhar Warrior. I'm a cardiologist. I work at Aster DMs. Thank you.
I'm Dr. Ajit Kumar. I'm the endocrinologist. Endocrinology deals with hormonal issues, including diabetes, thyroid, and related. I work in Aster Medical Center cases. Today I'll be discussing or answering questions on the prevention of diabetes.
Hello, I'm Dr. Mahavir. I'm a urologist. A urologist deals with the kidney problems such as stones, prostate problems, male infertility, and male sexual dysfunction. Thank you.
I am Dr. Thomas Joseph. I am a gastroenterologist. I am working at Union Medical Center, Karama.
I am Dr. Shaji Haitrose. I am a general practitioner. I am actually your neighbor. I am practicing in this Aster Medical Center in Alcus, very close by.
Hello, last but not least, I am the psychiatrist here. My name is Dr. Rajiv Surendranath. I would be discussing or answering questions about stress and stress management.
We have a lot of things to discuss or ask them. Before going to the question and answer session, we will have a video presentation here. It's about basic life support system. This is part of the corporate social responsibility program of the DM Healthcare group.
At least once in our life, may have an opportunity to save a life.
Individuals above 65 years, it's almost mandatory that it is better to take they should take a flu jab, because the complications developing after having this flu is more serious in these two extreme ages. But the rest of the individuals, it is advisable to take a flu jab, annual flu shot, so that the attack. Flu is caused by a virus, which is of around more than 16 strains of that. So this vaccine is not covering all these strains. Only 2 or 3 strains, which are major all over the world, which can create this epidemics or pandemics. So these vaccines will give protection against these 3 virulent type of attack. And maybe some people will have mild feverish feeling. There is not such major side effects on these flu jabs. And
taking antibiotics, is that effective way, or if regular use of antibiotics is weakening your immune system. Is that such a thing is there? Or?
No, actually, flu is caused by a virus, and there is no role for antibiotic in a flu attack.
But if it develops into a
No, that is the great concern. Like when the patient is having, after 4 days, 5 days, if it is not coming down, the fever is high, and the patient is having cough and chest pain, or something which is not normal for a normal flu infection. It is better to consult a doctor. Always before starting an antibiotic, better to consult a doctor. And he will assess you, because normally the complications of flu is, first is pneumonia. And it could be a viral one or a bacterial one. That only by assessing the blood test and all these things, one doctor can understand. And if it is necessary, the antibiotic is a mandatory thing for treating these secondary infections because of the bacteria. Not for the flu, because flu is a viral disease and there is no role for antibiotics for this viral disease. And I'll just talk about something about the chicken pox also, because chicken pox, it is better to take chicken pox vaccines for adults. That is from 8 years onwards, because in children, chicken pox attack will be very minimal compared to adult. And in older age, the complications are more. Both this flu and chickenpox can cause this brain infection, which is called encephalitis. And they can have this viral pneumonia, which is very resistant to treatment and all. So chickenpox from 8 years onwards, if you take a chickenpox shot, even if you develop chickenpox in the future, it's very rare, but even if you develop, it will be very minimal. And the complications will be very, very less.
Doctor, how about the preventive measures? We know basically, hand hygiene plays a role.
Prevention.
But if you could reinforce all those things.
Yeah. That is, if somebody has got flu, then it is personal hygiene is very important as far as to prevent the spread of the disease, especially because if flu and chickenpox both spread by cough droplets. So any personal contact, a close contact, that means at least 15 minutes face to face with somebody in a closed room, it is a contact. That means you have had a contact with the infected person. In that case, and once you develop this, it's better to take care of your secretions, tissues, what you use, and when you touch, and frequently use these hand sanitizers and all. This will help to spread the disease, in fact. Cut down the spread of the disease.
How you can people take care of that? Because you are treating so many patients per day.
We have, personally I have taken these shots, and normally doctors, they get slow immune development for this, mostly this viral disease, because of the constant contact with these patients. Yeah, they get some sort of an immunity. But if a doctor gets some infection, it will be really good one.
Bad one.
Doctor, most of us sitting in the room are parents, I guess, and I just wanted to ask you what kind of preventive measures other than this we should take in case of children, because they go to school.
No, children, if the child gets the infection, flu, better let him be at home and give him rest, don't let them play around, then let him have fluids, a lot of fluids and food. And if 3-4 days, after 2-3 days, if he is not improving, definitely you should consult a pediatrician for children, as far as children is concerned.
Thank you so much, Dr. Shetty.
You're welcome.
The topic of high blood pressure or hypertension, which is one of the most common health issues facing the global community and the UAE, with more than 35% of the country's population affected. High blood pressure is associated with obesity and can lead to the other potentially serious health issues such as heart disease, kidney failure and stroke. We have Dr. Shekhar S. Warrier, the cardiologist here, to tell us about what kind of preventive measures that we need to take against developing high BP and ways to control and reduce.
Thank you. Good afternoon, everybody. Actually, blood pressure is a normal thing. Each one of us has a blood pressure, right? I'm sure most of you are knowing that basic, and there are two numbers associated with it. One is the numerator, which is the systolic blood pressure, and the denominator is the diastolic blood pressure. The systolic blood pressure is the blood pressure that is measured. It's the pressure that the flowing blood exerts against the wall of the arteries when the heart contracts, and when the heart relaxes, the diastolic blood pressure is measured. So that is the basic thing. Now, what has been found is that if the blood pressure is more than certain levels most of the times of the day, then certain diseases like heart disease, stroke, kidney problems, heart failure, etc. are more commonly seen. That is the reason why blood pressure is usually treated. It usually does not produce any symptom. So when most of us believe that if I get a giddiness or if I feel dizzy, I got blood pressure, I get headache, I got pressure. 90% of the times blood pressure is detected when it is measured during the course of a normal visit to a doctor for some other illness. And or it is detected when you already have got into some trouble because of high blood pressure. Now, today's discussion is going to be on preventive blood pressure, so I will stick to that after giving this brief introduction about what exactly blood pressure is. Actually, we can look at prevention from 2-3 angles. Like first of all, most important thing is the primary prevention of blood pressure. Primary prevention of blood pressure is that we all have good habits. We walk regularly. We eat 5-6 times small quantity of food with a lot of vegetables, fruits, etc. in our diet. Don't smoke. If at all you consume alcohol, then take a little bit of alcohol. Don't go on binges. Quantity should be less. Should be occasional. These are the things that usually increase the blood pressure. Managing stress at regular intervals, like job stress. Azad Moopen sir was talking to you about how journalists are prone to more stress. And when we had a vocational visit to the center, we understood the amount of stress that you people go through. No wonder sir was speaking about this previous wisdom. Now, what exactly happens is when you don't take enough breaks, the pressure tends to go up. This is what is known as the primary prevention. There are certain conditions where blood pressure is very common, like in the next few questions about diabetes, etc. Blood pressure is usually associated with these illnesses. So even though when you have those illnesses, but you don't have blood pressure, we can do what is known as a secondary prevention of blood pressure, where between the onset of disease and the detection of disease, there's a gap. During that gap, when we try to prevent the illness by doing corrective measures, which I already said, salt restriction, food, high fiber food, etc., stopping smoking, moderating alcohol, that is called the secondary prevention. And the tertiary prevention comes in when you already have established blood pressure for some time. You may or may not have any complication because of that. At that stage also, prevention is useful. Besides all this prevention, there is something called primordial prevention, where Khaleej Times can play a very important role. It is to prevent the development of the milieu in which these risk factors develop. Like if we educate children to walk regularly, if we educate mothers to walk regularly, if employees take regular breaks, then the chance of getting the risk factors in themselves which produce these illnesses will not happen. That's called primordial prevention, which is somewhere where media and institutions like us come together and can work together.
Thank you so much for the piece of advice, but Doctor, we all know that Khaleej Times is known for giving a lot of health awareness reports and also being part of some awareness programs and all. But as I mentioned in the beginning, the problem is that we tell people to do things, but we ourselves don't walk the talk. Rather, we don't walk at all. No. Anybody has any questions to Doctor?
Doctor, you will be talking only about BP or cholesterol level. So I heard that these are the three things: blood pressure, high blood pressure, cholesterol, and diabetes. So the combination.
Actually, all these problems, they cluster together.
Yeah.
It is called metabolic syndrome, where you have obesity, physical inactivity, diabetes, high cholesterol, high blood pressure. Most of these people have high stress, high level of smoking incidents, alcohol consumption. So all these things, they come together. And I think today I have been asked to speak on. I definitely don't mind answering on cholesterol also if you have some doubts.
We have doctors talking about diabetes and other...
No, on this HDL and LDL,
Yeah.
we have a doubt. See, is it true that if we take a lot of nuts, for instance cashew nuts, omega-3 is there, and is it a reduced finding?
Well, actually, the various mechanisms by which HDL goes up, besides exercise, which is the most commonly accepted method of increasing HDL. HDL is actually the remnant of once the cholesterol is taken away, whatever the molecule, the lipoprotein molecule, which was what is remaining, that is called high density lipoprotein. Now, there are various ways. It has been found that a high level of HDL is associated with a protective action on the heart and the vasculature. But how do you increase it? One of the standard accepted way it should be increased is exercise. It goes up by many other methods, but exercise is the only accepted way in which HDL, if it goes up, it protects the heart.
But taking this cashew nuts or for instance, sort of
that I don't think is very clear on that. That doesn't support the usage of that.
Maybe it's a new theory.
Yeah, I mean, a lot of people have a lot of understanding over it. I'll think.
Don't worry, you can ask some nuts.
Taking cashew nuts, sorry, I'm the endocrinologist. Taking cashew nuts will not help you to have a higher HDL cholesterol. Stopping of smoking will rise the HDL.
Omega-3 is
Omega-3 fatty acid, actually, omega-3 fatty acids used therapeutically is helpful to lower the triglyceride. It won't help you to increase the HDL.
There are some drugs which increase it, but then they have not been found proved to be useful.
Yes.
In protective action.
Which is the best oil to use? Cooking oil.
That's a good question.
Tell us one.
No, there is no single best oil. Olive oil is good, and
You can't use it in cooking, right?
we could use gingerly oil is very good. That is more expensive than olive oil. Then canola, safflower oil, sunflower oil also is good enough. Rice bran oil. These are all the options. Rice bran oil.
How about virgin coconut oil?
Yes. Coconut oil, you could use virgin coconut oil, not the usual one. Virgin coconut oil has many antioxidants and many protective factors. And virgin coconut oil.
The first expression of the coconut oil.
Coconut oil. Like, in olden days, people in Kerala used to extract coconut oil out of,
Coconut milk.
Yeah, exactly. Out of milk.
Oh, you used to take out the...
Without drying the coconut, you extract oil from the coconut.
It's usually used to be given to kids and all.
Yeah, small babies.
Yeah.
We just spoke about BP, right? So usually people connect BP with heart disease and stroke and seldom think about its role in kidney failure. I'm not sure how many of us are aware that some people's blood pressure cannot be controlled even with multiple medications, which is a condition called resistant hypertension. We can ask Dr. John Cherian Varghese, the specialist nephrologist here, how is RHT related to kidney? And in fact, I have read that one of the possible causes of resistant hypertension is thought to be due to the miscommunication between the kidney and the brain through the sympathetic nerve of the kidney. What is the sympathetic nerve of the kidney doing? It plays a crucial role in the body's ability to control blood pressure, it seems. So doctor, could you please tell us about this and the other renal diseases which are very common here and the preventive measures against them? I think you will exclude kidney stone because we have Dr. Mahavir to talk about it later.
Thank you for the question again. First of all, the first part, that is resistant hypertension. So when do you call resistant hypertension? So a person who is having hypertension, his blood pressure is very high and he's taking medications. Now we have different classes of medications. So if they take more than 4 types of medicines, and despite of all this, the blood pressure still continues to be high. Now what is the level to be high? Maybe 140 or 90. If it still remains above this level, then we might be able to call it as a resistant hypertension. Now before we go into calling them a resistant hypertension, it is very important to know that if the person is taking the medicine or not, because that is the most important thing. Occasionally what happens is they might take one tablet, they might not like the taste, they might feel a bit giddy, and they'll just stop taking it. So we'll be going on prescribing it, and they'll be keeping on accumulating it. So the most important thing is to know is whether they're taking the medicine the right way at the right time. Second most important thing is the amount of salt intake. Now it is very well known right now that if you take a lot of salt, your BP medicines will be resistant and it will not act very well. So it's very important that you take care of the added salt. All these fast food, all things which contain excess salt, this can make your BP medicines more resistant to action. And despite of all of this, if the still BP continues to be high, then we call it as a secondary hypertension. That means there might be an organ which is involved, which is leading to this hypertension. The commonest among this is the kidney. So you have a problem within the kidney, which leads on to increase levels of certain hormones. As you mentioned over here, the sympathetic nervous system. It is nothing but the part of the nervous system which leads to adrenaline and noradrenaline. It helps us in certain situations like fright, flight and all. So in some people this will be overacting. So that can also lead on to increase in hypertension. We also have some of the endocrine causes which can also lead to hypertension, and we have a condition where the blood vessels to the kidney, they become narrowed, and we call it as a renovascular hypertension. So these are some of the causes of hypertension, but the encouraging part is that 90 to 95% of the causes are usually a primary, and that can be easily controlled, and this is just 5% of the general population of all cases of hypertension.
Doctor, what you just mentioned, apart from the scientific part of it, one simple but most important point I felt is taking right medicine at the right time. That is where most people, don't actually follow and then end up in problems. Not just in the case of hypertension, I think even in other diseases also.
You said it right. Actually, at least we are seeing less amount of those cases over here. Now, when we come in from developing countries, the main factor over there is, of course, the cost. At least here, majority of us have got insurance. So at least we get medicines, and it's just a matter of just taking the medicine. But in developing countries, this is like an impossible task. Already they have a lot of budget constraints. And on top of that, if we prescribe very costly medicines, it will be difficult for them. I think even the corporate social responsibility might also include this to help this developing country, these patients, especially chronic medicines. And one good news is that at least in UAE, all the chronic medicines, the price is going to come down from January 1st, which is definitely encouraging. So we have more people.
Yeah, we had reported about it, my colleague Asma.
Very good. So that at least these patients will be compliant with the medicines. And regarding the second question, which are the commonest disease over here, now 2/3 of people with kidney problems will have diabetes or hypertension. So these are the main causes of kidney problems, not only in this community, all over the world. So people with diabetes, with hypertension, they need to screen themselves for kidney problems. This can be easily done with a simple urine test. You can ask your general practitioner or you can ask your internist to do this test. And if there is something coming positive out of that, then you can always consult a nephrologist. Then of course stone disease is very common in this community because of the arid climate that my colleague will be talking about that.
Is there any other symptom of kidney failure other than going to a doctor and finding out, but is there any other signal the body gives that you are having a weak fever?
This is a good question. Unfortunate part of this is that the symptoms of kidney problem are very subtle, and only a very probably a committed person can know this difference. So one of the few symptoms are, one is your pattern of urination will change. So normally in the night, after we sleep, we don't usually go and urinate because that is our kidney's ability to concentrate. But this is lost in early cases of kidney failure. So you will be waking up in the middle of the night with urge to pass urine, and you will be passing a large amount of urine. So this is one of the earliest signs. Then the consistency of the urine might also change. You will note that the urine will be more frothy than usual. So if you notice that, and that even after flushing there is still some bubbles there, then again this would suggest that there is some amount of protein going through the urine. Again a sign of this. unusual weight gain. When you wake up in the morning, you find your face puffy, your eyes are puffy, your feet is puffy, and is remaining there for quite some time. This again has symptoms of this one. And your blood pressure, which was before, which was very well controlled, suddenly goes up. The medicines has not changed, your diet has not changed, your BP is just going up. That again is a sign of a kidney problem. So subtle changes.
How about color of urine?
Definitely, if you drink less water, your color of urine will be more.
Okay.
Because whatever solutes you excrete will be going in a concentrated urine. If you drink water, if it comes back to a light color, then it's okay. But if it remains dark colored, occasionally you have conditions where it is dark red or even black. That will suggest that there is a kidney problem.
How much water we should consume in a day?
That's a good question. Almost everybody asks me. Yeah, everybody asks this question. It depends on person to person, on the diet that they do and what work they do. So what I generally tell the patients is that you observe your urine. If it is light yellow to white in color, you are drinking enough. So that if your urine is light yellow to white, means clear. In that case, you are drinking enough water. So that now if you are working inside an office environment, you won't be requiring that much of water. But if you are working outside, if you are sweating a lot, you might need to take more water.
Is drinking too much water a problem? Overworking the kidney or anything like that?
Yeah, luckily the kidney is facing a lot of brunt other than the water. All the toxins that you're taking every day, it's being excreted by the kidneys. So you have enough and more kidneys to take care of the water, don't worry. And just a general information.
There are a lot of emails circulating that if you consume more water, also is equally not good for the kidney. So
maybe I think the endocrinologist can also help us with some of.
Yeah, so basically general information is that your kidney daily filters 180 liters of blood. So I don't think we will be passing that much urine. So after that only just 1% we are passing, that is around 1.8 liters. So I think it can take much more. And regarding this, if you take solute free water in large quantities, maybe you might have electrolyte disturbance. Other than that, usually the kidneys can be able to tolerate. So around 4 liters should be fine. We have patients taking around 4 to 5 liters, especially post-transplant.
what about this low sodium water? We are promoting low sodium water.
Well, if your kidneys are alright, you don't have hypertension, you don't need a low sodium because the kidneys are there to take care of that. But if you have hypertension, maybe it might be a bit. But the normal water that we get over here, the sodium content is very less.
So, doctor, there is another perception about kidney, donating kidneys. So people, there are a lot of role models before us, in Kerala for instance. Several people donated one kidney and said, they are now doing very healthy and they are in the very good, keeping very good. But how risky it is to donate one kidney and to save, maybe it could save a life, but is it risky or what are the
so, yeah, we have started this kidney transplant way back in 1964. So we have people who have donated from that time who are still living healthy. So many years, definitely it won't make a change, but then definitely before giving a kidney, we have to screen the person who is giving the kidney. If he has hypertension, if he has diabetes, if he has stone disease, we will not encourage him to donate. So if all these are negative, and then if all the conditions are suitable for him to donate, yes. And in spite of this, there is a risk of maybe around 1 to 2% that they can develop a hypertension or a kidney problem in the future.
Since our topic is related to prevention and we are running short of time, I'd like to request you to restrict our questions related to prevention. Yeah. Now that we were talking about this water intake, I think Dr. Thomas can also help us with this. I guess you are the right person to tell us. I'm not sure how much of water and what time, because Nitya was just saying about the emails, and there have been some emails which say, I feel that it's practically a useful question, that's why I'm asking this. They say that it's good to take water before you take a shower and before going to bed and blah blah. So it will be good if you can tell us when is the right time to drink water.
Now, regarding gastrointestinal system, water intake, when we have some symptoms like bloating, we call that functional dyspepsia. in which there is some movement disorders of the stomach. Okay, in those patients, we will ask the restrict water with food. Okay, we will ask them to drink water at other times, not with food, just before or just after. Other times you can take as much as water as you want.
There is nothing like you should have water before going for a bath or
Nothing like
and people say that it's always good to have water before you go to bed and immediately after you get up. How true is it?
No. Actually, what we advise them is to have your breakfast and whatever you drinks 2 hours before going to bed, because if you go to bed after having your meal or water, there is chance of it reflecting back into your esophagus. So regarding GI tract, we advise water to be taken at other times and not with food, and to take water at least 2 hours before going to bed.
Thank you so much, Doctor. I think that was a good piece of information for us that practically daily life it would be useful to us. We were with talking about kidney diseases, and now we have Dr. Mahavir Subhash Deshmani, who will tell us about kidney stones, which is very common in people here. People sit in AC and don't drink water, and that is said to be one of the main causes also, I think. So doctor, could you also tell us about that and the preventive measures apart from drinking water?
Yeah, you are right. Kidney stone is very common in the UAE, in this arid climate. In spite of us not going outside, we are actually, the air conditioned air is dry air, so probably that is one of the reasons that there is more incidence of kidney stones. But the main reason of kidney stones being common is our modern lifestyle. In the last 100 years, the way we are working and our diet has changed. Everything is contributing to some of the modern diseases. Kidney stones is one of those. Now, stones can be of many types. The commonest is calcium oxalate stones. So, in very simple terms, to explain it to you, as you know, there are 2 kidneys in the body. The function of the kidney is to filter blood and produce urine. So, body has many types of salts. Whatever we require is in the form of salts in the blood, such as calcium, magnesium, phosphorus, uric acid. So, after filtration, whatever is required for the body is taken up and used, but whatever is extra, whatever is waste, it is excreted through the urine. Now, if the salt concentration is higher, it will precipitate into crystals. So, this is what we call stones in very simple terms. So, if stones occur, stones in the kidney, small stones in the kidney usually do not cause any problem, but if they come in the kidney pipe or in the bladder, then they can block and then you can have pain and infection and further complications.
How about the preventive measures, doctor?
So the preventive measures, as has been rightly said, water intake is one of those. Water should not be excessive, water should not be less. So the best way I tell my patients is whenever you are thirsty, you drink a glass of water. Do not delay it. If you are thirsty now, you should drink it now. What people do is they go home and then they drink 4 liters or 5 liters as was advised or they have read somewhere, which is obviously wrong. So you should, especially sitting in an office environment, you should make it a point that you drink water. Your mouth should not be dry, as has been explained. Your urine should be clear, light yellow or colorless. These are the 2 indicators. Second preventive measure is non-vegetarian food, because it contains a lot of animal protein, calcium, that will predispose you more to formation of calcium stones. So animal protein should be restricted. Ideally, you should eat 2 or 3 times a week non-vegetarian food in all forms. So if the third thing is green leafy vegetables, spinach and all, they also can predispose to stone formation. So same thing, twice a week. And salt should be restricted. Salt restriction, they say it should be 6 grams per day. So ideally whatever salt is there in the food, that's fine, but do not add extra salt. So I don't think you need to do any major changes in your diet to really change anything. Whatever your grandfather or grandmother they were eating, if we follow that, and
that's quite difficult here, you know. And since we are talking about the importance of water, and then he just mentioned again about the need to reduce non-vegetarian food. I guess from tomorrow onwards we will all have our water bottles on our desk, and then we'll avoid having more chicken and all that stuff.
But doctor, if that is the case, why in Western countries, they are not vegetarians? The currents of this system.
This data is from Western countries that they advise you to restrict animal protein. So if you compare in most of Indian diets, actually we don't usually use so much of this thing. But these are the only things that I can tell you as a doctor. Actually, if you form stones, you will form stones. That is the fact.
Again, water is very important, even for the women, especially when you talk about urinary tract infection. So we have Dr. K.R. Rahul here, who can tell us something about UTI and the preventive measures that women, employees of Khaleej Times, can take.
UTI is why I chose to speak on UTI. Amongst the gynec problem which we come across as routine in UAE, most common is UTI, urinary tract infection. And women as such is more prone to it because of their anatomy. And here being in the office, most of the women population here in UAE is working. And in the office, because the AC is on, so and the humidity is so high, a person doesn't feel thirsty enough to take water. Secondly, the time restraint and the work target is so much that many times women avoid to go to washroom. They withhold the urine for longer time, longer duration, and the length of the female urethra is very small, so that again predisposes it to the bacterial infection. So, and again less intake of water and lesser use of washrooms, withholding the urine. These are the main reasons of more UTI, and women can avoid it first of all by drinking lots of water, almost 8 to 10 glasses in a day. And as soon as you feel that there is any symptom of urinary tract infection in the form of increased frequency to going to the washroom, or if there is any burning, or if there is any dysuria, like there is pain or pain in the abdomen while passing urine, these are the symptoms. You should go and see the doctor immediately, take the proper antibiotic which has been prescribed, and in home remedies one can use cranberry juice, which is again a urinary alkalizer to take care of the symptoms of the urinary tract infection. Because if UTI not taken care of in time can cause the infection of higher organs like kidneys and the ureters, and again can predispose a person to stones and all. So it is better if this problem is taken care of in time.
Thank you so much, Doctor.
This water can be taken only in pure water form or
basically,
mixing it with something else?
The water is water, H2O, 8 to 10 glasses. Besides this, juices preferably.
No, so you don't include a tea, for instance. If you are taking
tea and coffee, no, couple of cups.
Huh?
No.
Beverages.
They are beverages.
Is it true that the water that is sold in the UAE, different companies, Safi and Evian and Boss, you have all these design. What is the difference? Which is the Alain? Which is the best water you can have? Is it just
the doctor will be endorsing some product here, yeah?
I'm asking this because generally when we go back home to India, the water does seem to be like
I think that is for you to report. We are not. No, it's a very good question, very interesting one, but I think it needs investigation. And
The Khaleej investigation by a journalist. You should tell us.
Thank you, Jasmine, for the question. I'll take it forward to the Dubai municipality, which is actually in charge of, testing the water quality and the amount of minerals and other stuff in water, distilled water, I will definitely do a story on that. Doctor, please. Yeah, he has something to tell us.
Yeah, regarding the taste of the water, basically the taste differs based on the solutes, the amount of salts that are present in
That's
it.
what I'm asking.
Now, here in the UAE, this water, especially alkaline water and all, is natural spring water. So the taste is a natural taste. And most of the water in UAE has been based on this natural taste, because the people over here are used to with this taste, and they like that taste, and that's why that's been there. Now, in different countries, the taste will vary. Now, if you go to European countries, they don't want their water to be that much, too much salty. So they like it to be less salty. So that's why Evian and all those Perrier and all, they taste different. So that again depends on geographic area.
There is high salt.
Yeah. So pure water is distilled water, which is tasteless. Pure water is distilled water. There is no solutes. Other than that, number of salts that changes the taste.
Appearance can be deceptive, so taste can also be deceptive.
If you have to have this salt in the water, some amount of salt in the water, it should be there.
Yeah. Otherwise, it is tasteless.
No, otherwise it will affect your body also.
Definitely, yeah.
Because you are taking some salt from the water.
That depends on your preference. If you like lukewarm water, yes. Some people like it that way. Some people like it very cold. But basic thing is once it goes into your body, it will be neutralized. It will be in.
That read somewhere that you lose a lot of weight.
Yes.
Yes.
No shortcuts on that.
That's a general advice which they give after having lunch or heavy food. After biryani, people take tea. And then at least they say if it is very heavy, take a glass of warm water.
Okay, last question on this.
It's just one's own experience and belief and faith. That's it.
This theory of a glass of hot water or warm water in the morning with honey. No, with honey. Honey and lemon. How
Making you sleep.
Is that also
That is wrong.
Is that also myth?
That's a myth.
Oh God.
Honey.
Sorry, Jasmine.
Honey and hot water. I think that is the last question for us so that we can lose weight that way.
But how about lemon?
That's all.
Again a myth.
Doctor, I think someone else told me that if you add lemon, if you take too much of lemon, it will actually be bad for your health. You will get more joint pains or something. Is that true? Or spondylitis worsen and all that?
Nothing like that.
So we are breaking so many myths here, yeah?
That's not true.
No.
It seems very purpose at all.
It will be tasty.
There are no shortcuts.
No, I'm talking. We all clean. We are practicing.
No, lime juice.
She is taking honey.
Actually, lime juice with soda, it will prevent stones because it will alkalinize the urine. So lemon is always good. It has vitamin C, and the adequate amount of vitamin C is also preventive for flus.
But for certain people with allergies, it's not good, I guess, yeah?
No, nothing.
Yeah, regarding patients with heartburn, reflux disease, lime juice is not good because it is can stimulate acid production and cause heartburn.
Actually,
in those patients it is not good.
Yes, I'm coming back to you on heartburn and GERD and all that, yeah. Now I think it's time for us to go to Dr. Azad Kumar, the expert in diabetes and the rate of which the UAE has another top position in the world. It's not just in making buildings and firework display that we have records. We have such infamous records as well. So doctor, please tell us about the lifestyle changes and other precautionary measures that we can take against this condition, which is all about sweet but very sour for our health. We have already talked about the importance of exercise and other stuff. So what more can we do, as preventive measures?
It's basically about the change in lifestyle over the past 200 years, and especially for the past 50 years, that has led to the high prevalence of diabetes to epidemic proportions. That is basically because of modernization, mechanization. You're not working the way your grandparents used to walk or work. And urbanization, the food, quantity of food also. Previously there used to be famines and feasts mixed together. Now there is no such situation at all. There is continuous feast. There is overnutrition that is leading to obesity, overweight, and in addition to these factors, sedentary lifestyle per se will lead to increased risk of diabetes. Suppose you take two obese individuals, one is very physically active but obese, other one is not physically active but obese. Physically active obese people are prone to develop less likely to develop diabetes than the other one. And regarding the genetic factors, actually the Asian population is at very high risk. That's why South Asians especially, they are at risk of developing diabetes at lower waist circumference or lower levels of obesity as opposed to the other population. So you have to be, like what he has told about primordial prevention. Basically you have to start education at level of schools to promote the children to adopt healthy lifestyles so that they won't become obese or overweight as they mature. That is the most important thing. That generally fails because people don't listen to us. And the media or the food companies, they don't want us to do that. Seriously.
The media doesn't want that.
No, not the media, not the press. The advertisements.
Yeah.
I mean that. So that's one important thing. So once there are risk factors, you try for primary prevention or secondary prevention, and numerous trials have clearly proven that the most important thing to prevent diabetes, most important step to prevent diabetes, especially to prevent diabetes for long periods, is weight loss, improve physical activity coupled with calorie restrictions. You have to have at least 30 minutes of walking or any exercise per day, coupled with calorie restriction, that is the amount of calorie needed for your weight sustenance minus 500 to 1000 kilocalories per day. You have to have a negative calorie balance with regular physical activity to have sustained and regular weight loss, and weight loss should not be rapid. You should not go for this, that, Oxford, Cambridge, this, that. I think many of the people here will be aware of those things. Going for those diets will not be of use. Actually, they won't help you to sustain the weight loss. The important thing is to induce the weight loss and sustain it. Weight loss should be 0.5 to 1 kg per week initially, and sustain it. And even if you have lost weight by say about 7 to 10% of the current body weight, that is adequate, that will do. And even if you have reverted, you have stopped doing all the lifestyle measures, even after that, even 20 years from the initial period, say initial period is for 5 years you have been participating in a trial where these measures have been done, and 5 years is the duration of the trial, 20 years later the protection remains. And the prevention of diabetes, the percentage reduction is 58% by lifestyle measures alone, 58%. And drug therapy can be given for selected patients, but it is not that effective. Most important thing is lifestyle measures to promote physical activity and reduce the caloric intake, basically to induce weight loss. And drug therapy could be considered in selected individuals, not in all.
As a prevention.
Prevention, yes.
I think mainly in people with some pre-existing
Yeah.
conditions
Like, the main
polycystic
factors are
ovary disease.
polycystic ovary and the actually, there is no point in trying to prevent diabetes in elderly. More than 60, it might fail. And in lean individuals, drug therapy might fail. And drug therapy alone will not be that effective. You have to couple drug therapy with physical activity as much as possible.
See, the normal or the borderline is 120, isn't it? The reading says, the borderline.
No, the normal range fasting glucose normally is up to 100 only. Even within the normal range, the higher the fasting glucose, the greater is the risk. Suppose you have 100 or 99 and she has 77. 77 will take many years to cross to 101 to become abnormal. 99 can cross easily to 101 in the next year. So the higher the normal range, the greater risk of progressing to diabetes.
So it's not 120 anymore. Now
126 is
Never 120, I swear.
126 is the cutoff to different diabetes.
So
126 fasting glucose.
at what stage, people should be concerned about taking or bothered about taking medication? When it crosses 20 or 120 or it can wait up to...
No, it all depends on the risk factors. Suppose someone has family history of diabetes mellitus and the age, family history or other risk factors like previous history of diabetes, previously reported high glucose, impaired glucose, fasting glucose or impaired fasting glucose is fasting glucose more than 100 but less than 126. Impaired glucose tolerance is after meal value more than 140 but less than 200. So more than 126 in fasting and more than 200 in after meal value is diabetes. So in between these ranges it is pre-diabetes. Or there is one more test, I think most of you will be aware of that is HbA1c. That also if it is in the borderline range, that is pre-diabetes. So people with pre-diabetes, with history of gestational diabetes, PCOS, family history of diabetes, and all of us, by virtue of being South Asians, all of us are at risk of diabetes. So if a South Asian is having one more risk factor, he should be having regular screening at least once in 3 years.
Since we are running short of time, I think I'll go to the next part of this, which is also connected. In fact, we say diabetes and hypertension are silent killers. Okay, but are they really actually the real culprits at the bottom line in this part of the world, or is it the high rate of obesity that is the underlying cause of these two big health menaces here? We've also heard about the threat of diabetes explosion, which is a dangerous combination of diabetes and obesity. I think both of you or Dr. Kea also, I think she's also listed to talk about obesity in women, especially. So
maybe
tell us something about
the period issues might be discussed by her possibly. The metabolic aspects I can discuss.
Yes.
See, sedentary lifestyle with weight gain, that is the root cause for all these issues. Whether it is, he mentioned about the metabolic syndrome, where the patient will have hypertension, high glucose, low HDL and high triglyceride. And this clustering of risk factors happen because we are all predisposed to develop diabetes mellitus or all these metabolic abnormalities. So what do we do to prevent that? Because we are predisposed, we should be extra careful. Be very physically active, avoid, drop the sedentary lifestyle, and if you have excess weight, you try to shed it.
Yeah, basically whatever you have been talking about now. How about in the case of women, doctor?
See, in ladies, obesity not only affects their joints and diabetes and hypertension, but also affects the menstrual cycle. And these days what we come across as routine, it is in a phenomenon of polycystic ovarian syndrome. And it is very sad and unfortunate that almost out of 10 girls, 4 of them are polycystic ovarian syndrome, which are in their early teens. And later on they are again, they have high tendency to become a diabetic after they cross 35. And not only on that, like it will affect their fertility. So that is why I want to speak on that. That is a polycystic ovarian syndrome. And it happens that normally a woman ovulates 12 times in a year, every month. But these girls, they ovulate only 2 times or 3 times. They have irregular periods. They have abnormal hair growth, like more on the face and upper lip, chin, and centripetal obesity is there, along with irregular periods. And once they get married, they have real difficulties in conceiving. It is because there is abnormal metabolism of carbohydrate, which produces more of the male hormone rather than the female hormone, which causes the periods and conception. So again, obesity is the one which is playing role, and the factor is the lifestyle. The way we used to play outside, the girls hardly play. They are mostly have sedentary habits, they have studies, and they play more on iPod, iPad and all these gadgets. Second is food habit. The food is very conveniently available here in UAE, which is sort of junk food. So we should stress more on avoiding the eating of junk food. Like once in a week it's okay, but not all the times. more of the food which is having, even if a child is having carbohydrates, it should be having low glycemic index, that is the carbohydrate which gets metabolized slowly, like in vegetables it's broccoli, kale, then again beans and lentils. Amongst fruits it's more of the apple and grapefruit, and amongst dry fruits it's more of walnut and almonds, which should be stressed in a routine food. And lots of exercise, not much, even if 30 minutes in a day, 5 times in a week, it is more than enough. Go for more for omega-3 fatty acids, which is plenty, which is available in the primrose oil, as well as in flax seeds and bran and high fibers. And again, go for organic foods and more active outside, and use more of the time staircase rather than taking lifts. These are the certain things which we can change in our routine, and so that we can avoid polycystic ovarian syndrome, which is really taking lots of toll on the fertility status of women these days.
Especially in this region, I believe.
This region,
yeah.
Majorly.
And since we were talking about obesity, I'm glad to see our government here taking a lot of measures against this, you know, as you were
even giving gold to women.
Yeah, even that also, and among the children, that there are a lot of regulations now which ban for junk food and fizzy drinks.
Fizzy drinks are not to be given to children and to pregnant women. If you go to supermarkets,
yes,
that area is marked.
Yes, energy drinks are banned for all this risk group.
Doctor, what should be the ideal time gap between physical exercise, bath and breakfast?
The ideal time difference.
Yeah.
See, the physical exercise, there is no such thing. Generally, whenever you have time, you can go. Most of the people I see here who are working, like my patients, they go in the evening because in the morning they are in so much of rush. And generally there should be a gap of, I think, 1 to 1.5 hours, 60 to 90 minutes for the body's metabolism to settle down. And because again, digesting food is an exercise for the body. So there should be 60 to 90 minutes difference. What do you say, doctor?
Yes. 1.5 hours.
1.5 hours.
But shower is essential after the walk or physical exercise.
Sorry?
Bath.
See, what happens when anybody is taking bath? The whole of the body circulation, it goes more on the skin, you know. So the digestion gets affected. So one should avoid having shower immediately after food. Minimum 1.5 hours.
She asked about shower immediately after exercise. How much of shower?
Because why I'm asking this question is I live in Karama,
right,
and I see people using the park opposite to Lulu. They go for brisk walk and then they do work up half an hour. Then they go to Venus or any other food restaurant, immediately after the walk.
Okay.
They are tired.
Without even
they go and have a heavy
right?
breakfast.
Right.
So is that the right?
No, that is not the right thing. I think 1 hour they should give body time to adjust
and
to
even
the
hygiene wise also it's not so good, I believe, because they will be sweating and all that,
Yeah,
for others.
It's
difficult for others.
It's difficult for others also too. Yes. Okay, we have.
What are the vitamins that women should take as routine? Yeah, after certain age, like after the age of 40, they should go more for the, first of all, primrose oil and the essential fatty acids. And amongst vitamins, vitamin D is very important. And vitamin D not in the tablet form, but in the form of sunlight. Because when you are exposed to the sunlight, the body in centimeters, 18 centimeters of your body is, if exposed to sunlight for 15 minutes per day, you will get natural vitamin D, and that is more important for your bone and muscles rather than the vitamin D which you are taking in the form of tablet. That will be more effective if it is natural in source. So vitamin D should be a constant. If a woman who has breastfed a child for 6 months should take extra for 1 year to supplement not only in the routine but also the stores of the vitamin D and calcium. And vitamin E as such you can take daily because it is a very good source in the form of fish and oils, natural oils, and it's very good for your skin and hair. And vitamins as such you can, and they are de-stressors also. They say they are good for stress.
Is it okay to have all of them together, like, you know, at the same time, or you know, like take some in the morning or some in the evening?
See, generally vitamins we suggest like after breakfast you can take one tablet in a day in the morning, and vitamin D we suggest generally empty stomach, it is absorbed better, and once in a day according to the dose and schedule your doctor suggests. You can
For
take
men,
once.
what are the vitamins, you know, after 15? For men?
Yeah, of course, for men also.
Same. Same, I think they can tell better.
Just
There are so many of them.
more and get more vitamin D from the sun.
No, actually there is nothing like that. Unless you have some specific vitamin deficiencies, there is no need to take any additional vitamins like that. When you are having your proper food, means that it will be taken care of.
Calcium intake, doctor?
Let me answer. Actually, we are running.
Calcium intake, the daily requirement is 1 gram per day, and pregnant and lactating women should be taking 1 to 1.5 gram per day. The standard recommendation, the RDA mentions a lower intake, that is LTS. If you take less than 800 mg per day, there is risk of osteopenia and fractures. The bones will, or in simpler terms, the bones will get weak. The daily requirement for all adults is 1 gram per day.
As lay person, we do not know.
1 gram is 1 ml of milk is 1 mg of calcium. So, if you want to have all calcium out of milk, you have to have 1 liter milk, which is not possible. So, because that is source of calcium, other rich sources of calcium in the diet are like the fruits which are having high calcium include this seedapple and custard apple, and other fish, spinach it has, and fish, all the fish which are taken with bone, fish eaten with bone is rich source of calcium. Others are not very good source of calcium. So you have to, after an age, because say if women after menopausal age, they are at risk of osteoporosis, and they generally are on lower calcium intake, they won't be drinking milk. So it is nice for them to have, among all what you have asked about vitamins and everything, best is to have calcium. Others, maybe you will be having adequate intake unless you are vegetarians. Vegetarians are at risk of developing few deficiencies like B12. Otherwise, from a common diet, you can have all of the vitamins. Among the essential nutrients important to supplement is calcium actually. And vitamin D, she has told.
Yeah, now Dr. Thomas Joseph was about to talk more about gastric problems earlier, acidity and all. I think it's a another very common problem in the UAE or this part of the world. So could you also tell us about what are the precautions against these issues, you know, and ulcers?
No, when we are talking about ulcers, ulcers actually means a break in the mucosa, that is the inner lining of the stomach. So most of the cases that we see are not by the true meaning word ulcer are ulcers. They come under the category of dyspepsia. So ulcers truly means that you should have a break in the mucosa of the stomach, and the usual symptoms are pain and bloating, nausea, vomiting and all. And contrary to the popular belief, food does not play much role in ulcer formation, except for the fact that spicy foods have mild association with ulcer formation. And the main important thing, main positive factor for ulcer formation is H. pylori, which is a bacteria. In 80% of patients with ulcer, it is H. pylori which causes ulcer. And H. pylori is transmitted through the orophageal route. So that means that it gets into the body from contaminated food and water. So the best way to prevent ulcer is to maintain personal hygiene. And then eat cooked food, vegetables and other foods. And the next important cause of ulcer is NSAIDs. NSAIDs means painkillers. So the over-the-counter use of NSAIDs can cause ulcers. And whenever whenever you are going to have NSAIDs or painkillers, it is better that you check for H. pylori, because both of these factors acting together can worsen the situation. So whenever you are going to have a painkiller, it's better that you check for H. pylori and then eradicate it. Eradicate it means that we treat for H. pylori with antibiotics for a course of 10 days, and then only it is recommended to take painkillers, especially if you are going to use it for a chronic use. And then reduce the use of NSAIDs to the maximum. And then if you have to take it for a long time, especially in patients with some risk factors like previous history of ulcer disease and all, it is better that you take a drug that is acid reducing drugs along with these NSAIDs. And regarding food, I told that only spicy foods, there is a weak correlation. And then smoking. Smoking with H. pylori can exacerbate ulcer formation. So patients with ulcer disease should quit smoking. And alcohol also is found to increase the incidence of ulcer formation. So it is better to quit alcohol as well. And then the next thing is emotional stress. So it has also got a weak link. So persons with the stress, as all of us are more likely to develop ulcers. So this is regarding ulcers. But most of the patients coming to us with the symptoms saying that acidity, ulcer and all are coming under the category of functional dyspepsia, in which when we do the endoscopy, it will be normal. There will be no ulcers, only thinking that they will be having these symptoms, and it is related to the movement disorder of the stomach and related to some neurotransmitters there in the stomach. So this is not true ulcers. In that case, we will advise them to have some dietary restrictions. As I was told you earlier, not to drink too much water with food, and then to have small frequent meals rather than going for big standard 3-time meal, and then to not to have food just before going to food. That's it.
Doctor, I think GERD, gastroesophageal.
Yeah, GERD is a different. GERD is a different. It is not ulcers. GERD is a different.
Eventually cause ulcer, I believe.
No. GERD means gastroesophageal reflux. It has a different mechanism. So the acid is produced in the stomach. So it should, ulcer means ulcers are there in the stomach or in the first part of the duodenum. So GRD means the acid is coming back to your esophagus, that is your food pipe. And that causes heartburn and regurgitation. Regurgitation means some fluid coming back to your sour fluid coming back to your mouth. So these are the two symptoms of GRD, heartburn and reflux, that is regurgitation. These are the symptoms of GRD. So this is a different mechanism. And in that case, usually we advise some dietary restrictions, especially.
How about the importance of having breakfast, in such conditions?
That is in patients with GRD, we usually ask them to have some dietary restrictions as well. Especially coffee, because this happens because the lower esophageal sphincter, that is the wall there at the lower end of the food pipe, is weak in these patients. So the acid comes back to the esophagus. So caffeine causes relaxation of this wall. So coffee should be avoided. And then chocolates, then fatty foods, and then aerated drinks, all those should be avoided. In spicy foods, especially spicy foods, patients taking spicy foods will have this heartburn. So this should be avoided in patients with GRD. Although studies have not shown definite relation with these food factors, but then we usually advise them to avoid these things, and then to have, as I already told, have small frequent meals, and then avoid this water with food and all those things.
Thank you, doctor. We are running very short of time, and now we have already covered most common diseases affecting our physical health, and I think it's high time that we looked at things that affect our mind too, which is very important. And people say healthy mind will only be in a healthy body, but what if the body itself is giving a lot of stress to the mind? So we live in a stressful era. People are always stressed out and trying to keep up with the fast pace of this world. And stress is always associated with certain professions, one of which is our field, the media or the journalism field. Today we have Dr. Rajiv Surendran to tell us how to keep stress away, which always wants to be a part of our lives, especially in this part of the world.
Thank you. I would start off by saying that stress is normal.
It's part of our life. Yeah?
Even otherwise, it's Dr. John mentioned fight or flight response. That's a normal physiological response by which our bodies have been programmed to deal with any kind of threat. So stress is normal. We all get stressed. Now, when does it become a problem? It becomes a problem when the demands outstrip our resources. When the demands are more than what we have to offer, what are the resources we have. So we have more stress, but we run out of resources. Stress becomes a problem, and it affects every aspect of our mind, our physical health, our mental health, our relationships, our social functions. So that is when stress becomes a problem. How do we know we are under stress? When we find that we are not the people that we used to be, that is a warning sign. So when we become more snappy, more irritable, when we are distressed, when we are anxious, more than normal, when we find that we are not performing in our work environment as we used to do before, when we find that our home life is getting affected, when we find that we are taking our work back home, when we find that we are running late all the time and never achieving targets, and it is eating into our personal and private lives too, that's when we know that stress has become a problem. I think because of time, we'll focus on prevention.
Yes, of course.
In terms of prevention, the first thing would be to say that we should recognize that stress has become a problem. Recognition, first of all, acknowledge that we are under stress. Stress has become a problem. And third is understand the mechanisms and do something about it. Our chairman very elegantly expressed his view that we should put us first before work, before family. We should look after our health first before we try and sort out other problems, try and help other people. And he mentioned physical health, mental health, social health, and spiritual health as the four legs of the table that holds us up. I fully agree with that. So in terms of prevention, physical health, key to everything. Stress affects our physical health in a lot of ways. Equally, paying attention to our physical health, looking after ourselves, our bodies, would help with cutting down and decreasing the stress that we experience. I think we would struggle to find people who are very happy with the way they look after themselves. Doctors certainly do not look after themselves. As our moderator has said, we talk the talk, but we don't walk the walk. I am sure the same would apply to journalists as well. Mental health, make sure that we have me times, time to look after ourselves, time to be the persons that we used to be. I'm sure we all have things to say that I used to do that. I used to paint. I used to draw. I used to play sport, and these are the things that we've left behind in our rush to be successful. So try and find time for the me time. Try and find time to be outside of work. Try and find time to to spend with your family. Try not to take your work home. Try not to let it spill over. It's called negative spill. Your work pressures and tensions spill over into what should be quality time with your family. Try and spend time with your children. They grow up very quickly, and they'll be out of your lives pretty quickly. These are all kind of ways to de-stress. Spiritual health, prayer, meditation, whatever works for you. One of the issues with stressed people is that they change in behaviors. You drink, you smoke more. Be aware of these changes in yourself and try and cut back. As all the other doctors have mentioned, these things have huge impacts on your physical health as well. So it helps to take an inventory of what you've been and how you've changed over time, and slow down. Life will look after itself. You need to slow down and look after yourself.
How about good sleep, sound sleep, and better time management? I guess they also play a big role in
Absolutely.
taking away stress
Yeah,
from
work
our
stress.
lives. I know that very well, but I'm very bad at doing that.
We all are, I think. Time management, certainly, it helps you be more efficient in what you do, and certainly in the work environment. If you can learn to prioritize, doctors are typically poor at that, I would say. I certainly am. You learn to prioritize. You learn to say no to people. If they are putting more pressure on you, say no. Know your resources and use them wisely. Time management wise, be organized, and it all pays off in the end. You'll be more productive, plus your stress levels are likely to be lower. Sorry, what was the second? Sleep. Yeah, sleep is one of the things that get affected very easily. Any addictions, any stress, any physical illnesses, you don't sleep well. That could be one of the warning signs of being under stress, when stress has become a problem.
Isn't it vice versa also, doctor? If you don't get enough sleep, don't it stress you out?
Absolutely. Yeah. If you're not getting enough sleep, then you're likely to become more short-tempered, more stressed, more irritable. So they're both closely linked. How do you improve your sleep? One of the things that I tend to advise people about is about sleep hygiene. There's a concept called sleep hygiene where you prepare yourself for sleep. It's all common sense. Try and wind down before bedtime. No TV or bright lights in your room. Smartphones, precisely. They keep you awake. No coffee, caffeine, or other stimulants. Prior to sleep. Really common sense stuff, but they do work. But it takes time.
Doctor, what do you advise for staff? Some of the staff I see, they have their lunch in front of the computer. They are working. They are
not a good idea.
Yeah.
Not a good idea. I do that too, but
I've seen it in today.
But what about a short nap, in the afternoon for those people who
We
can
should have a
afford
bedroom here.
No, for them,
short
sitting, yeah.
cat naps come highly recommended. Yeah.
People say that it's a power nap. Is it
Yeah.
really good? 5 minutes, 10 minutes, yeah.
I personally feel that it is good for me. I try and do that if possible.
Bit of exercises,
Yeah. Exercise.
Definitely help in keeping away the occupational health hazards also. Especially we are desk bound mostly,
Yeah.
So that is good enough. For those
Cat
people
nap.
who can afford.
Yes, absolutely.
Everybody.
Of course. Physical health, take a walk. Instead of picking up the phone and talking to somebody across the room, walk to him or her and talk to them. Go out for a cup of coffee. Climb stairs, as somebody else said, instead of getting the lift.
And also say no to your boss sometimes.
Precisely. That can be a learned skill.
This after Sagir has left.
No, this is live webcast. He could be watching upstairs there, yeah?
And I have one question for the doctor. Doctor, you said you cannot drink water 2 hours before sleep. That is not possible. Yeah?
It is still a big issue.
Okay.
But that is a recommendation, especially in patients with reflux disease. Reflux disease, when you lie down, no, you are flat, no. The sense of this fluid coming back into your esophagus.
Yeah, but it's not in large quantity, but in a...
Yeah, maybe a small...
We were told that it is always good to have, when you wake up, drink 1 glass of water. Yeah?
That is good. There's no problem drinking water on waking up. But not...
There's no generalization in this, it's a specific problem. He's talking in people who have got GERD. It's not nice to have. If you want to have water, it's fine. That's okay. We don't have a problem. I don't think he's saying that nobody should have water, isn't it? I think
Especially in patients with GI. Now, regarding this...
people who have GERD.
I think we should always also remember about the importance of having breakfast every day and probably small portions of food in more frequent times. All this, most of us know that as we have been saying, we are not following all that.
So I have one more question, doctor. See, I have asked this question with several cardiologists about alcohol. See, some doctors, cardiologists like Cherian and and Dr. Cherian. They said, it's good, you can have to, that is 120 up to that. But he's telling me, or what do you think to say that?
120 is an interesting question. It always is. Actually, there is a myth that alcohol is good for health. To tell you frankly, what is medically permitted is, in case of men, is 20 to 30 grams of alcohol, which comes to about 60 ml. 60 ml drink, not 120. 60 ml of normal liquor, 40% proof, will contain about between 20 to 30 grams of absolute alcohol. For women it is half of this, so it's 30 ml, one small, what is generally known as. Anything more than that is calories, number one. Yeah, 1 gram of alcohol is 7 calories. So when you have, it is as bad as ghee. Ghee has got 8 calories and this has got 7 calories. So when you have 100 ml alcohol, you are almost having one meal extra. 40 grams into 7 is 280. So it adds to your weight, it adds to your triglycerides, it adds to your... Anything more than this increases your blood pressure, and any binging actually results in irregularity of heart beats, which can sometimes result in stroke, etc. So it is not a wise idea, except believing that alcohol is good for health. Number one. Number two, the social problems associated with alcohol. Once you start taking alcohol, the anxiety goes. Now you are a little worried. You are asking me a question. Once you start taking alcohol, you will never worry about this question because the anxiety is not there. So you will have 2 more.
That's a good piece
You will forget Dr. Shekhar and you will forget this thing and say, "Ek to chalta hai." Once in a while, it's okay. Now that is the second problem of having alcohol. Right? It takes away judgment. And gastroenterologists will agree that there are some people who are prone to get liver cancer, hepatocellular carcinoma, etc., cirrhosis, etc., which is another risk. So I think he is the best person to talk on that.
We have seen a lot of people, regularly taking alcohol and living.
Yeah, it is because of something known as Mediterranean paradox. The Italians, the French, they do take wine and they do live longer. It is more to do with the kind of eating habits they have. They eat 5-6 times small quantity of food. They eat a lot of fruits and vegetables when they drink wine. They eat a lot of fish. So this is responsible, not the alcohol. Alcohol has been wrongly given the credit for longevity in case of the Mediterranean paradox. Probably, this is my opinion.
One more myth.
But yeah, this is
one more myth.
One more myth. This is myth buster.
Yeah.
So 120 is best 60.
Yeah, sure.
I hope it doesn't spoil
I just like to
Thursday
add one thing.
bath.
Yeah, I just like to add one thing. The good thing about South Asians are they take the best from all communities. So this is the best from the Europe. They like the fast food. This is the best from America. They like the heavy meals, which again contains a lot of proteins and everything. They like to take all the best from all around the world, and that will be their main meal. So again, if alcohol is so good, why don't we give it to all our family members, including children?
There is a perception that it is good for unwinding.
Yeah,
It's
that is the only thing it
perception,
does.
it's not scientific.
That is the only thing it does. It's a good anxiolytic. Dr. Rajiv will agree with it. It's a good thing. If you are restricting yourself to 60 ml before bedtime, it's good. Probably.
I think one of the best things to do is to keep a dog. You'll be walking, you will pet it, you will have no stress. Everybody is going to be happy. It's a complete de-stressor. I've always believed that you must have an animal in the house.
I would like to add something.
Other than the husband.
I'm a dog lover. I'm a dog lover, but I must tell you one thing. My dog is fat because I am fat.
Yeah, of course. I have even written an article about it. About obese pets in the UAE.
Yeah.
It's not just the
When you look at my
owners who
dog,
are obese.
when you look at my dog, you will know that I need exercise.
I have been rescuing dogs and cats for now 17 years in the UAE. And Indians generally are not on my top list to rehome the dog because they want, purebreds. But I always say this. You must have a pet in the house, which is excellent
But
for
here,
children.
just when here we have another problem also, like many people
Flats.
live in flats. So it is not advisable to keep
Again.
their pets at home.
Again a myth. If
It's
you
not
have-
a myth, it's as per the rules.
It's not a myth.
Yeah,
It's
it's
not
as
a
per the
myth.
rule also.
Recently,
Yeah.
one Indian couple had few dogs actually.
Yeah,
But
4
they
dogs.
were euthanized.
Yes.
Why it happened?
4 of them.
Why did it happen?
Yeah, that I can tell you. I think they won't want to wait for it, but I can tell you that we've handled the case. But generally, I think the restriction is there in certain apartments. But if your apartment does allow, it's excellent because you can
It's
walk
a
your
rule
dog.
from the municipality, in
But
fact.
not for all, Sajila. There are areas like Discovery Gardens and JVP and all, where even if you're in a studio, it doesn't matter. You have a GST, if you walk your dog twice a day, it's exercise, it brings your stress levels down. You know, it completely changes your conversation in the house because, you know, how much are you going to talk after marriage, being married for 25 years? Kids will bring the same issues at home. So, yeah, I think so. I think also
You can have
kind
a
of
fish.
parents
Yes,
also.
you can have a small fish.
Yes, why not? Fishes are great, you can feed them and watch them.
So it's time for us to end this very interesting and informative session. I hope you all had very great, pieces of information which we were not aware of, though most of it was, as doctors were saying, common sense, but some things were really unknown to us. The doctors broke a lot of a lot of myths. And I thank each and every one of you without taking your names from the bottom of my heart and on behalf of Khaleej Times for this conversation. And all of you for being patient and leaving your work and sitting here with us. Yeah.
Thank you, Dr.
And thank you, Sajila.